To control diabetes, the turning point is for her to understand that medication is not her salvation. First thing, if she puts all her chips not in the casino, if you put all your chips on medication, you're going to lose. This is the first level of awareness that a person needs to have. The medication will stabilize my condition, but it won't make me reverse it, which is what we want. So I have to take other actions here to get healthy again, and that is possible. When she understands that, she doesn't take a step, she takes a leap toward reversing diabetes. Then you have what I call steps. You can't just say this to a diabetic patient, as I always say. Starting tomorrow, you have to cut out sugar, you have to cut out bread, you have to stop eating rice, you have to quit your beer. But to stop completely, this guy won't stick to it. It's not like that.
He can't.
He can't. None of us can. It's a ladder. You have to go step by step, little by little. That's the thing. He can even do a bunch of things he likes if he does them in the right order. Do you want an example? Breakfast. What do most Brazilians do? Wake up, have breakfast. What's a typical Brazilian breakfast? Coffee, lots of sugar, or coffee with milk, right? Lots of sugar, bread, and margarine. Isn't that it, Brazilian breakfast? Yes, it is. Your insulin is low because you went 8 hours without eating. That's pure carbohydrate. Sugar is carbohydrate. Bread is carbohydrate. Milk has carbohydrate. Cake. Only margarine doesn't have carbohydrates because margarine is something worse than carbohydrates, right? It's a esterified fat. That's another discussion. Then this guy puts in a bunch of carbohydrates, high glycemic index carbohydrates. His insulin is going to shoot way up. That's what we call an insulin spike. That causes insulin resistance. That person is quickly heading towards diabetes. If she made a simple choice, instead of doing that, she could eat, for example, an omelette first. An omelette first. Then eat this bread with margarine and it completely changes the insulin spike. Why? Because you ate the omelette. It has fat, it has protein, and it has little carbohydrate. Your insulin rises more smoothly. It will already make it harder to absorb the carbohydrate. So when you eat the carbohydrate, you don't get the insulin spike. Did you get it? Just a little tweak. You didn't take anything out. I haven't taken the sugar out yet. That's why I say you have to go step by step. Then you go, guys, let's make some smarter choices. Let's do this, turn it around, transform it. Now let's take this out and so on. It's not taking it out forever. No, just take it out for now until you reverse it. Just take part in our masterclass on Tuesday. Tuesday is my masterclass where I'll talk exactly about this step-by-step process I'm telling you here. I want to bring this up in the class because we need to have time just to explain this, right? Because it's a step-by-step process. I'll also give some tips, some teas. In fact, I'm drinking a tea here, a nice cold one. That helps. In this process of reversing diabetes, I'll talk about supplements. I'll talk about these combinations I just told you about. I'll talk about a series of, I won't call them tricks, no, but strategies that can really improve your insulin sensitivity. So the first tip I give is to join our masterclass Tuesday at 8 o'clock. The link will be there, folks. I forgot. There will be a QR code. The team will put the QR code on the screen. The link will also appear there. It will also be in the video description, okay? Sign up, fill it out, and join a WhatsApp group. In that WhatsApp group, you will find all the instructions on how you will participate, okay? And at the end of this masterclass, Vanessa, I will also open up some spots for those who want to participate, for those who want my personal supervision in reversing their diabetes. I will make this opportunity available during the class, so you have to attend the class live. But I would say the following. I'm not even going to spend 5 minutes. No, I've already spent 4. Diabetes is not a life sentence. Diabetes is not a life sentence. You are not doomed to stay diabetic. It is possible for you to reverse diabetes. Of course, it depends on the degree of your pancreatic impairment. I don't know how your pancreas is. But especially if you are at the beginning, especially if you are not using insulin yet. É possível reverter. Insulin? diabetes condition. You will lose weight, you will reduce inflammation, you will improve your overall condition, and you will decrease the risk of having. A diabetic has 4 times more chance of getting cancer. A diabetic is 6 times more likely to have a heart attack. A diabetic can lose a limb, can go blind, can end up on dialysis. Look at the size of the problem. So maybe diabetes isn't a problem for you today. I don't know, you're 45, 50, 55 years old. But in 10 or 15 years, it could be a problem. You don't want to end up in a dialysis room. You don't want to have a heart attack. So that's what I would say to this person. It's not a life sentence, it can be reversed, but you need a strategy, you need the right way to combine foods, what you can have at first, what you can't, some teas that will help, some supplements that will help, the medication, how it's being used, how it's being taken. So there's all of that to consider.
Is there a right order of care, medication, diet, exercise for those who really want to control diabetes? Key.
Actually, there isn't a specific order. The treatment is a combination. It's what I said right at the beginning. If you only treat diabetes with medication, which is what most people do, okay? The person takes the medication and says, there, I did my part. That's how it is. I see this every day, but you're taking the medication properly. You go on, your disease is progressing. It's not in remission. It's neither stopped nor in remission. It's progressing, just at a slower pace, thanks to the medication. It's progressing more slowly. Is the medication important? Yes, that's why I say don't stop taking it if you're on it. That's one point. Second point, lifestyle change. When I say lifestyle change, it's what I mentioned. It doesn't mean that, oh, now I can't do anything anymore. No. It's about eating right, based on more natural, less processed foods, right? It's about making choices.